I want to go to your letter. I apologize. I got a few, if you won't mind, Chair. Going to your page 1, bullet point 2, your letter does not assess the accuracy of self-reported long-term care data. Who is the individuals that would be the individuals entering that data, that you're questioning the accuracy of that data?
The staff at the long-term care facility is required to report it.
And who would that include?
I would imagine in nursing homes, it could include nursing supervisors or other administrators. At adult foster care facilities, it could include the owner-operator. Just depends on who is responsible for doing that sort of reporting.
I see. So generally licensed professionals.
Licensed, facility licensed, yes, not
Right, but
necessarily
many of them,
health providers.
but all of them are operating under a license. You only, with the data that we're looking at, that you're arguing, your letter does not assess the accuracy of self-reported long-term care data.
Right.
And my question is, if you seem to imply that there's an issue with reporting data and its accuracy, and you question the Auditor General as to they didn't require facility-by-facility investigation. My question for you is, if you're questioning the accuracy of people who are, particularly licensed facilities, their accuracy in reporting, what are you doing or working with Laura to address those accuracy issues if we are questioning whether that's accurate data?
We are using data from a different data collection platform than they are. So we're talking about verifying the accuracy of the self-reported data. They're looking at the MDSS data, verifying for accuracy. So it's two different.
Because you're the one that raised this, so I'm asking the question, in what system are you questioning the accuracy of self-reported data, and what system is that data going into?
I am questioning the accuracy of the data going into MDSS. And that is not being updated by those licensed professionals. I'm sorry, I misunderstood your question.
So it's your system. It's DHS's system.
Yes.
MDHS. So you're questioning the accuracy of the people that enter it. What are you doing to deal with questions of inaccuracy? Because if they're inaccurately sending data, my question is, you're suggesting that there was, do you feel that there was intentional misrepresentation of the data that was put in?
I understand what you're saying. When we are talking about the Michigan Disease Surveillance System, the accuracy of the data that we are looking for to verify is the presence of a reportable communicable disease and where the person is or has been. Those are the two elements of that data system that are verified. And that is the purpose of the system. So at this point, we have no need to require further verification because we don't utilize that system for other purposes. Okay,
so I guess, but you also raised that we need to update our systems, but you say you don't really use that system, but you're also saying that you're challenging the Auditor General that they didn't do a facility-by-facility investigation, nor are you doing a facility-by-facility investigation to determine the accuracy of that data anyway. So you're kind of challenging them for their issue based on the use of your system and not questioning the people that are entering the system, but they're going to say, well, we don't use that system anyway.
We don't use that system for the purpose that the Auditor General used that system.
But if we have a system that we can't count on, then why do we even have a system?
Well, we do have a system we can count on. That is the self-reported system through EM Resource. The MDSS is not a system that is used to track death data. I think you're confusing our different platforms.
Well, either way, that's your platforms, and you've indicated these platforms are out of date,
yes.
And you're suggesting that the Office of the Auditor General should have done a facility-by-facility investigation. But if you're questioning the data that's being entered and the people that are putting it in, it's Laura and DHS that is oversight of the people that enter it, not the Auditor General. So if you're saying that they should be doing these investigations, they should have gone facility to facility because we're questioning the integrity of the data, then we have a system that we're maintaining that you don't trust the data that's going into it, or we need to fix the system.
I trust the data that's going into it that I need from that system.
But if we know, the point of, I think the Auditor General said, we're using the system to find who had COVID, and then you do a death record, and you go, oh, okay, we have a record that they had COVID, now they had death, now we can kind of match this up. We don't have a perfect system.
Right.
So So you're questioning about that system. Is that still, I think the problem lies in Laura and you at DHHS if there's questions about that system, not the Auditor General using the system that you maintain. So I won't beat a dead horse on that. We'll move forward. Page 2, there's 3 bullet points under the first 3 bullet points in the center of the page. It says, we know your count includes the following cases that do not meet the definition of reportable COVID long-term deaths. And it says individuals have been discharged from long-term facilities prior to death. Their categories include former residents who recovered from COVID-19. Now, I had specifically asked the Auditor General whether they included former residents who had recovered from COVID-19, and basically said they were using your data, and no, they weren't necessarily using included people that who had recovered from COVID-19, since you guys set the criteria. So my question is, what is your number that you're, first off, I think there's a glaring conflict between what you're saying they did and what they said they did, because they seem to say they didn't include people that had recovered, and you're saying they did. So that's a concern. Would you like to answer that?
Yeah, when the Auditor General staff went through their data with our staff, their indication to us was that they did include that. The response here today from them to you was the first time that I heard that that was excluded.
Okay, well, I mean, it was in their letter, and your letter speaks to their letter, to their position. So could you tell me then how many people you feel are in that category of former residents who recovered from COVID and simply returned to home with their families or were discharged to hospice?
No, I couldn't guess.
Okay. How many individuals who were hospitalized for a non-COVID-19 reason, such as a fall, then subsequently acquired COVID-19 outside the long-term care facility?
I couldn't guess.
Individuals who did not reside at a long-term care facility that were required to report, but instead resided in a non-reporting facility on a shared campus, such as a continuing care resident community. Do you have a number for that?
Somewhere under 1,300, based on the data that they have.
Okay. So my concern with saying, we know that your count includes, and you don't actually, that could be 1, or it could be 20. So you're discounting their data saying, well, there could be 1 in there that you did, so it's bad data. When in fact, you don't really have data to show to the extent there was an issue in that.
Our goal is to report accurate data, so if it is off by 1, it's inaccurate.
Well, I think we have enough research to show that your data is inaccurate, because if long-term care doesn't include long-term care facilities, you stated included adult foster care, correct?
That we count 13 beds or more, yes.
Okay, so I'm a paramedic in addition to being an attorney. I will say that I don't count human beings, their value, based if it's 13 or 12. When I went to an AFC home, that life was the same whether they had 13 or 12. So the fact that we're saying, well, we're not counting it and suggest that it's not in the long-term care, I also think is ridiculous. I would like to question you. You made a statement of 15 years of disinvestment in IT. I'd like to draw to your attention a memo from February 26, 2019 from House Fiscal Agency. Over 15 years, as noted, the average increase over the same time period is approximately 6.3% gross. There's been 3 recent DHS IT programs enter. It is clear that, and this, that's not reading it out of there, over the 15 years noted that we have made significant increases in funding in IT, particularly to some of the programs that the Auditor General used, Bridges and CHAMPS, both have been updated. So fortunately, because while term limits cuts me off in a year, I still remember giving the department $15 million because the department overspent money that was not appropriated to them, that they didn't have authorization, that we actually gave the department the $15 million even though they weren't authorized, and an additional $47 million that because they spent money that wasn't authorized, that we cleared up the books and appropriated it. So I struggle with, it would seem, having talked to House Fiscal, that we have been giving DHS the money to update their IT system. So it bothers me when you cite in your report the problem with our recording is out-of-date IT systems, and if I can go to your one statement, and finally, I would welcome your partnership in calling for legislative action to improve data collection and reporting in the future by investing in public health infrastructure. I will say that it's frustrating because you said multiple times that the system is out of date and we haven't invested. It would seem that we are investing, and the choice not to invest in MDES or the other ones is actually DHS decision, because it would seem the legislature has been funding this. I also would like to bring up to your attention when we talk about the issue of investing in public health infrastructure. This legislature passed a stockpile bill to ensure that there was PPE because there was a shortage. We have approved a 2-month supply of PPE. The approach chair, Albert, I've discussed with him. He has an interest in funding it. And I made a request 2 months of your department, 2 months ago, to give me numbers on what it would cost to have 2 months of PPE. You have historical data to support it, and you haven't provided it. So I will say that I am particularly provided what it's going to cost for 2 months of PPE. And I will provide the emails to support that I've asked for it and not received it. But I struggle with this letter that throws the legislature under the bus like we're not doing what we're supposed to be doing. And it's very clear that we have been giving money, the necessary funds for IT to the department. And if it's not getting done, it's an issue of DHS not to have a system that's working. And clearly, as far as public health infrastructure, you know, I think there's a willingness to support making sure there's a stockpile so we're not out of PPE, and I still haven't received an answer. So I challenge you to continue to point the legislature as the problem in this.
Thank you for your comments, Representative. Representative Outman.
To give her an opportunity to answer whether she would like to correct her 15-year report of
Director.
disinvestment in a system.
Do you want to respond to that?
No, I appreciate your comments.